Hello, you're listening to the Charles Bonnet Syndrome Podcast. My name is Shaimond, and today we're exploring a fundamental question in medicine. What is a syndrome? We'll uncover the history of the word, what makes a syndrome unique, and how it differs from diseases and disorders. Whether you're a patient, caregiver, or just curious, this episode will give you a thorough understanding of this important medical term. A syndrome is a group of signs and symptoms that consistently appear together and characterize a particular abnormality or condition. Unlike a disease, which typically has a specific cause and a set of defined symptoms, a syndrome is recognized by its pattern, the way certain features run together in affected individuals. If you notice a recurring set of symptoms in different people, but can't always pinpoint a single cause, you might be looking at a syndrome. Now, I wanted to take some time to talk about a syndrome because Charles Bonnet Syndrome is a syndrome, and syndromes have some unique characteristics and properties, and understanding what a syndrome is can help bring some understanding about Charles Bonnet Syndrome and where we are with it and where we hopefully can go. The term syndrome comes from the Greek syndrome, meaning a running together. The prefix syn means together, and dromos means running or course. The word entered medical Latin and then English in the 16th century to describe a number of symptoms occurring together. The concept of grouping symptoms is ancient. Medieval and Renaissance doctors described illnesses by collections of symptoms long before the causes of diseases were understood. As medicine advanced, especially in the 19th and 20th centuries, the systematic cataloging of symptom patterns became more refined, and syndrome became a staple of medical vocabulary. Many syndromes are named after the doctors who first described them, a practice called eponymous naming. For example, Down syndrome is named after Dr. John Langdon Down, and Charles Bonnet Syndrome after Charles Bonnet. More recently, there's been a shift toward descriptive names based on symptoms or causes, but many historical names remain in use. Let's break down what defines a syndrome. A syndrome is identified by a recognizable pattern, a group of signs, objective findings like a rash, and symptoms, subjective experiences like pain, that consistently appear together. Unlike diseases, syndromes often lack a single identifiable cause. The underlying mechanism may be unknown, variable, or multifactorial. Not every person with a syndrome will have every feature. There's often a spectrum of symptoms. A syndrome can be associated with one or more diseases, or it can exist independently as a pattern of symptoms. Symptoms are often diagnosed by recognizing the recurring pattern, not a single test or biomarker. Syndrome versus disease versus disorder. These are terms sometimes used interchangeably, but they have distinct meanings in medicine. Syndrome, definition, a group of signs and symptoms that occur together. Cause, often unknown or variable. Diagnosis, pattern recognition. Example, Down syndrome, Charles Bonnet Syndrome. A disease, a condition with an established cause, defined symptoms, and anatomical changes. Cause, usually known, biological, genetic, infectious, etc. Diagnosis, based on cause, symptoms, and tests. Example, diabetes, tuberculosis. Disorder, definition, disruption of normal structure or function, may be physical, mental, genetic, etc. Cause, may or may not be known. Diagnosis, functional or structural abnormality. Syndrome focuses on the pattern of symptoms, not necessarily the cause. Disease implies a known cause, defined symptoms, and often anatomical or physiological changes. Disorder focuses on disruption of normal function and can include both syndromes and diseases. For example, Down syndrome is a genetic syndrome due to the trisomy 21, but it's also considered a disease because the cause is known. Charles Bonnet Syndrome is a pattern of visual hallucinations in visually impaired people, but the precise mechanism can vary, so it's classified as a syndrome. How are syndromes identified and named? Eponymous naming. Many syndromes are named after the first physician or scientist to describe them, such as Marfan syndrome or Charles Bonnet syndrome. Descriptive naming. Some are named for their main symptoms or affected body parts, like acquired immunodeficiency syndrome, AIDS. Genetic syndromes. Increasingly, syndromes with known genetic causes are named after the gene or chromosomal region involved, such as 22q11.2 deletion syndrome. Examples of well-known syndromes. Down syndrome, caused by an extra copy of the chromosome 21, leading to characteristic facial features, intellectual disability, and heart defects. Marfan syndrome, a genetic disorder affecting connective tissues, features in the skeleton, heart, and eyes. Toxic shock syndrome, a rapid onset illness caused by bacterial toxins with fever, rash, and organ dysfunction. Why do syndromes matter in medicine? Pattern recognition. Syndromes help clinicians recognize and group symptoms even when the underlying cause is unclear. This can guide further testing and management. Research and discovery. Identifying a syndrome can spur research into its causes, leading to the eventual discovery of a disease mechanism or genetic mutation. Patient care. Knowing a syndrome allows for symptom management, patient education, and support, even in the absence of a cure. Genetic counseling. Many syndromes have genetic components, so diagnosis can inform family planning and risk management. The evolution of syndrome diagnoses from observation to genomes. Historically, syndromes were recognized by keen observation. Doctors noticed recurring patterns among patients. With advances in genetics and molecular biology, many syndromes once thought to be mysterious patterns are now understood at the DNA level. For example, what was once called Mongolism is now known as Down syndrome, with a well-defined chromosomal cause. Still, not all syndromes have a known cause. Some, like chronic fatigue syndrome, are diagnosed based on symptoms and the exclusion of other diseases. Common misconceptions and challenges. Not all syndromes are diseases, and not all diseases are syndromes. The terms overlap but aren't synonymous. Variable severity. The same syndrome can present differently in different people. Some may have mild symptoms, others severe. As science advances, some syndromes are reclassified as diseases when the cause is discovered. Sometimes patients have some but not all features of a syndrome. These are called subsyndromal cases. Helpful information for patients and families. Diagnosis can be empowering. Even when the cause is unknown, having a syndrome diagnosis can validate experiences and guide care. Management is often symptomatic. Treatments typically focus on relieving symptoms, improving quality of life, and monitoring for complications. Support networks exist. Many syndromes have dedicated support groups and resources for patients and families. Genetic counseling may be helpful. For inherited syndromes, genetic counseling can provide information about risk and family planning. The takeaway on syndromes. A syndrome is a recognizable pattern of symptoms and signs that tend to occur together, often without a single identifiable cause. The term comes from the Greek roots meaning run together, reflecting the way these features cluster in affected individuals. Syndromes are distinct from diseases which have known causes and disorders which focus on disruption of function, though the terms sometimes overlap. Understanding syndromes is crucial for diagnosis, research, and patient care, especially as medicine continues to unravel the genetic and molecular underpinnings of these patterns. Whether you're a patient, a caregiver, or simply curious, appreciating the history and complexity of syndromes can help demystify medical language and foster better communication with healthcare providers. Thank you for joining me, Shaimond, on the Charles Bonnet Syndrome Podcast. If you found this episode helpful, share it with others and stay tuned for more information on CBS and things that are relevant to the visually impaired community. I'll catch you on the next episode. If you enjoy the show, subscribe and rate the podcast. It makes a difference. And if you would like to contact me, you can email me at info@cbsyndromepodcast.com.